Congratulations! You have worked hard and you are now eligible for Medicare. How do you know that you qualify? You qualify when you turn 65 or have been collecting Social Security disability for 24 months. And you have worked and paid taxes to Medicare for at least 40 quarters, which is about 10 years. Applying for Medicare. If you are already collecting some form of Social Security, either retirement benefits or disability benefits, when you become eligible for Medicare, you will be automatically enrolled in both Part A and Part B. If you are not collecting Social Security when you become eligible for Medicare, you must enroll through Social Security. You can do this online at www.medicare.gov or www.ssa.gov/Medicare. Go to apply for Medicare only. You could also apply over the phone, 800-633-4227. Or, you could apply in person at your local Social Security office. You could locate the nearest Social Security office by searching online. www.ssa.gov/locator. Call 800-772-1213 to sign up for a Medicare Parts A and B or to find the location of your local Social Security office. Definition: Inpatient, a patient who stays for one or more nights in a hospital for treatment. Outpatient, a patient who receives medical treatment without being admitted to a hospital. A person who goes to a doctor's office or hospital for treatment but who does not spend the night there. Premium is a fixed amount you have to pay to participate. Most Medicare premiums are charged by the month. Deductible is a preset amount you must pay first, before Medicare or a private insurance company begins to help with your costs. Copayment or copay is a fixed amount that you pay, like $10, for a service or products. Coinsurance is splitting your healthcare costs with the plan on a percentage basis. For example, you pay 20% and the plan pays the remaining 80%. Part A, Medicare hospital insurance for inpatient care. Part B, Medicare medical insurance for outpatient care. Part D, Medicare drug coverage. Medigap, supplemental insurance that helps pay your out-of-pocket costs in original Medicare. Supplemental, to describe something extra. It is added when there is a lack or deficiency. What is Medicare Part A and Part B? Original Medicare covers 80% of your medical bills. The other 20% is paid by you from your own pocket, or is paid by Medicaid, state sponsor for low income, or the 20% could be paid by Medigap, Medicare supplemental insurance. What does Medicare Part A covers? Medicare Part A mainly covers hospital stays. Here are some examples of Medicare Part A coverage. Hospital care. This would include your room, hospital meals, nursing services, intensive care or medical treatment and monitoring. Operating room and recovery room services. Nursing home care. Hospice care. To manage symptoms and control pain for the terminally ill. Home health services. Rehabilitation services, such as physical therapy received through home health care. Skilled health care in your home if you're homebound and only need part-time care. Drugs, medical supplies and medical equipment as an inpatient. Lab tests, X-rays and radiation treatment as an inpatient. Some blood for transfusion in hospital or skilled nursing facility. Inpatient care in a religious non-medical healthcare institution. What does Medicare Part B covers? Medicare Part B covers medically necessary services. These are services or supplies that are needed to diagnose or treat your medical condition. It also covers preventive services or healthcare to prevent illness or detect the illness at an early stage. Here are examples of coverage for Medicare Part B. Doctor's visits, including an annual wellness exam. Ambulatory surgery center services. Screening and shots. Some preventive care, like flu shots and pneumonia shots. Clinical laboratory services, blood tests, urinalysis, etc. X-rays, MRI, CT scans, EKG and some other diagnostic tests. Some diagnostic screenings, like colorectal and prostate cancer screenings and mammograms. Durable medical equipment, DME, for use at home, including oxygen, wheelchairs, walkers, etc. Mental health care as an outpatient. Getting a second opinion before surgery. Skilled nursing care and health aid services, for the homebound, on a part-time or intermittent basis. Emergency room services. A few prescription drugs administered by a doctor, like chemotherapy drugs. Services from doctors and other healthcare providers. What does Original Medicare not cover? Original Medicare does not cover the following. Most dental care. Routine eye care. Routine hearing test. Most care while traveling outside the United States. Custodial care, helping with bathing, dressing, eating, etc. Long-term care. Cosmetic surgery. Most chiropractic services. Routine foot care. Acupuncture. Now that you have Medicare Part A and Part B, what should you do next? There are some options. First, you could use Medicare Part A, Hospital, and Part B, Medical, as Original Medicare. With Original Medicare, you pay a deductible and/or co-insurance when you get health care. This deductible you would pay out of pocket is usually 20% of the Medicare-approved cost for outpatient care. So if your doctor bill is $100, Medicare pays $80 and you would pay $20. You can go to any doctor or hospital in the United States that accepts Medicare. No referrals needed to see specialists. No prior authorization for services. If you want Medicare prescription drug coverage, you can buy a separate Part D plan. What is great about Original Medicare is you could go to the best doctor in the country and Medicare would cover 80% of your medical bill. The only problem is you have to cover 20% of your medical bill. There is no cap on what you spend on healthcare. For example, a typical heart bypass surgery costs about $70,000. Medicare would pay $56,000. You would pay $14,000. Second, you could enroll into a Medicare Advantage plan. This is also called Medicare Part C plans. These are sold by private insurance companies. You still have Medicare, but you are no longer with Original Medicare. You are in a private plan that has different costs and restrictions. Medicare Advantage combines all of the benefits of Medicare Part A, except hospice care, with all of the benefits of Part B. Medicare Advantage may also include prescription drug coverage. Medicare Advantage may also be bundled with eye care, hearing care, wellness services, and nurse helpline. Depending on where you live, some plans may not have any monthly premium. You pay a deductible and/or copay for services, usually a fixed copay per office visit. For example, $5 for your primary care doctor and $15 for specialist care visit. You are required to use doctors and hospitals in the plan's network. You may have to choose a primary care physician, get referrals to see specialists, and/or get prior authorization for certain services. Plans must have yearly limits on your out-of-pocket healthcare costs, after which you pay nothing for the rest of the year. If you want Medicare drug coverage, sign up for a plan that includes both health and drug coverage, called a Medicare Advantage Prescription Drug Plan, MAPD. In fact, most Medicare Advantage plans include Part D drug coverage. All Medicare Advantage plans must cover the same inpatient and outpatient services Original Medicare covers. Some plans also cover extra benefits Original Medicare does not cover, such as routine vision, hearing and dental care. From our example of a typical bypass surgery that cost about $70,000. If a Medicare Advantage plan has an annual maximum out-of-pocket of $5,000, you would pay $5,000 first. Then the private insurance company would pay the balance of $65,000. And if your medical situation occurs on December 28 of 2016 and continues till January 3 of 2017, as an example, since the maximum out-of-pocket limit is annual, you would need to come up with the $5,000 for 2016 and another $5,000 for 2017. So your Medicare Advantage plan would pay the balance of $60,000. If you do not follow the plan rule, like going to an out-of-network doctor, you may pay the full cost. You cannot buy a Medigap policy to help pay your out-of-pocket costs in a Medicare Advantage plan. Now that you have Medicare Parts A and B, Your third option is to buy a Medicare supplement insurance plans, also known as a Medigap. Medicare supplemental insurance work with Medicare Parts A and B. It is sold by private insurance companies. When is the best time to enroll into a Medicare supplemental insurance plan? Timing of your enrollment may affect your coverage choice and costs. In general, the best time to enroll in a Medicare supplement plan is during your Medigap open enrollment period. You could enroll into the Medicare supplemental insurance plan the month of your birthday, and 5 months after the month of your birthday. So if you were to turn 65 and enrolled in Medicare Part B in the month of March, you could enroll the month of your birthday, that is March. And 5 months after the month you turn 65, that is April, May, June, July, and August. Throughout this period, you can enroll in any Medigap plan offered in your service area with guaranteed issue. This means that insurance companies are not allowed to use your medical history or pre-existing conditions as the basis for charging you more for coverage or denying you of coverage. If you have medical issues or disabilities, it is especially important to take advantage of this period. Once your Medigap open enrollment period passes, you may not be able to enroll in a Medicare supplement plan as easily if you are doing so for the first time. If you are already enrolled in a Medigap plan, you may not be able to switch plans with guaranteed issue. Without guaranteed issue, you may be subject to medical underwriting and charged higher premiums based on your health status. Insurance companies can also deny you coverage if you have health problems. It is usually more difficult to find Medicare supplement coverage after your Medigap open enrollment period has passed if you have disabilities or pre-existing conditions. Even if you can find a Medigap plan that will accept you, your premium costs may be higher. Medigap or Medicare supplement plan helps pay some of the out-of-pocket expenses that Medicare alone does not pay. For example, it helps to pay costs like deductibles, co-insurance, and co-payments. Once you have Medicare Parts A and B, you can apply for Medicare supplement insurance plan at any time. There are 10 standard Medicare supplement plans. They are in alphabetical order, ranging from Plan A to Plan N. Each plan has different benefits coverage. It appears that Plan F is one of the more popular Medicare supplement plans. For example, Plan F covers Part A hospital coinsurance and deductible. It also covers Part B coinsurance, deductible, and excess charges. It covers cost for blood transfusion, foreign travel emergency, hospice care coinsurance cost, Part B preventive care coinsurance, skilled nursing facility care coinsurance, and there is no limit on coverage to your yearly out-of-pocket. Rates vary depending on your area, and at the moment, the monthly premium cost for Plan F is $140 for many Southern California areas. Medicare supplement offer guaranteed coverage for life, regardless of age or health. As long as your premium payments are up to date, and you have made no material misrepresentation on your enrollment application. With Medicare supplement, you are allowed to choose or keep your doctors and see specialists without referrals. You do not have to stay within a specific network. You could continue to see your doctor or specialist as long as they accept Medicare patients. Imagine being able to go to the best hospital to treat your medical illness. If you need treatment, imagine being able to go to the top cancer hospital, University of Texas MD Anderson Cancer Center, or the Cleveland Clinic for Cardiology and Heart Surgery, or the Mayo Clinic for Diabetes and Endocrinology Treatment. So if you keep your original Medicare and buy the Medicare supplemental insurance, you could go to the best doctors and hospitals in the country. Again, there is a premium for Medicare supplemental insurance. One of the more popular plans is Plan F. The cost is about $140 per month. $140 times 12 months is $1,680 per year. This is your out-of-pocket cost. Back to our earlier example regarding a typical bypass surgery that cost about $70,000. Original Medicare covers 80% of your medical bill, about $56,000. Your Medicare supplemental insurance would cover 20%, about $14,000. Your cost is only the monthly premium. You could go to the best doctor and hospital for treatment. In summary, You have some options once you qualify for Medicare. You have Original Medicare that pays 80% of your medical bill, and you pay the other 20%. You can join a Medicare Advantage plan that puts you in a network. You are restricted to doctors and hospitals within the network. Depending on the area you live in, you could have a plan that do not have any premium. And depending on the plan you choose, your maximum out-of-pocket cost is about $5,000 per year. Medicare Advantage is great when you are healthy. Once you get older and require more medical attention, the out-of-pocket cost may get expensive, especially for seniors. Or, you could keep Original Medicare and buy a Medicare supplemental insurance. The monthly premium varies depending on the plan you choose. One of the more popular plan is Plan F, and is about $140 per month. Original Medicare covers 80% of your medical bill, and Medicare supplemental insurance covers 20% of your medical bill. This is great because there is a fixed cost of $140. This allows you to budget your expenses. Your premium cost is based on your age when you join the plan. Medicare Part D. You need to enroll into Medicare Part D to cover your prescription drugs. What is Medicare Part D? You should enroll in Medicare Part D when you are eligible. You could call 1-800-MEDICARE, 1-800-633-4227 to find the best plan in your area. When can you join Medicare Part D? You can join Medicare Part D when you turn 65. Or, if you are disabled and under 65. Medicare Part D initial enrollment period is 3 months before you turn 65 years of age, includes the month you turn 65, and ends 3 months after. So if you turn 65 in the month of April, you could enroll into Medicare Part D during the months of January, February, March, April, May, June and July. What does the drug plans cover? Each Medicare prescription drug plan has its own list of covered drugs, called a formulary. Many Medicare drug plans place drugs into different tiers on their formularies. Drugs in each tier have a different cost. A drug in a lower tier will generally cost you less than a drug in a higher tier. In some cases, if your drug is on a higher tier and your doctor thinks you need that drug instead of a similar drug on a lower tier, you or your doctor can ask your plan for an exception to get a lower copayment. Most Medicare prescription drug plans charge a monthly fee. If you don't sign up for a Part D when you are first eligible, you may have to pay a Part D late enrollment penalty. The Part D late enrollment penalty may vary from year to year, and is about 33 cents for each month that you were eligible but did not enroll into Medicare Part D. This late enrollment fee is added to your monthly premium. So if you had forgotten to enroll into Medicare prescription drug plan for 1 year, or for 12 months, the late enrollment fee in the amount of $4 would be added to your monthly premium. If you have prescription drug coverage from another source when you were eligible, you would not be penalized for the months that you had prescription drug coverage. To find the best Medicare prescription drug plan in your area for you, go to medicare.gov. Look for Find Health and Drug Plans. Look for Personalized Search. Follow the instruction to enter your zip code, Medicare number, etc. Click on Find Plans. Or, enter the zip code and then Find Plans. Enter your Medicare coverage information. Then continue to plan results. Enter the medications you are currently taking. Then select the best plan. The Plan Finder will give you a list of companies in your area for Medicare Part D. It also lets you know which plan would give you the least out-of-pocket cost. Understand that some larger companies are able to get better rates for certain medicine, so they are able to put these medicine in a lower tier. So the best plan really depends on the medication that you are currently taking. There you have it. We hope you find these information helpful. Please share this website with your friends. Feel free to watch this video often, and write down phone numbers and websites that you find useful. Please email or call us if you have any question. Thank you for watching.